Our next speaker is Sharon Kolasinski. Sharon's professor of medicine at the University of Medicine and Dentistry of New Jersey and the Cooper Medical School of Rowan University, a new medical school that's been developed. Sharon received her bachelor's degree at the University of Pennsylvania, medical degree New York University. She was an intern resident at Temple and then was a fellow at the hospital at the University of Pennsylvania. She was then on the faculty at the University of Pennsylvania for a number of years and has recently left to join Cooper University. And she's going to talk today on an update on complementary and alternative medicine.
Thanks very much for that introduction and for the invitation to speak. I have no disclosures. Let's start with a little bit of history before we update. In 1993, the landmark article by Eisenberg and his colleagues at Harvard was published, surprising much of the traditional medical establishment in the US that about a third of our patients were using alternative therapies in addition to what we were prescribing. In 1996, this book appeared in many of your grocery store aisles, suggesting that glucosamine would cure osteoarthritis. In 1999, the National Center for Complementary and Alternative Medicine was commissioned as a distinct institute within the NIH and began federal funding for CAM research. And in 2006, the GATE trial was published. We had hoped that that would be the definitive answer about whether glucosamine and chondroitin were truly important interventions in osteoarthritis. But of course, the study was compromised by a very high placebo response rate, something we've heard a lot about this morning. So what's happened in the last 5 or so years? Well, let's go through that today. Oops. Let's start with the definition used by the National Center for Complementary and Alternative Medicine, suggesting that this group of therapies is diverse medical and healthcare systems, practices, and products not generally considered part of conventional medicine practiced by MDs and DOs and other traditional healthcare providers. The categories used by the NCAM to grant funding are these, and they're a useful way of thinking about the different types of alternative therapies that are available and that have had rigorous trials to support or refute. We'll be touching on some trials in each of these categories. Natural products, like herbal medicines, vitamins, minerals, and dietary supplements, and more recently, probiotics. Mind-body medicine, a very important area, interventions like meditation, yoga, acupuncture, and Tai Chi. Manipulative and body-based practices, like spinal manipulation and massage therapy. Movement therapies, where we're just beginning to see some studies. The practices of traditional healers in North America has not been an area where any contribution has been made to musculoskeletal medicine or rheumatic diseases. And some have suggested this is because most Native American medicine practices don't think of pain as arising from within the body, but rather as a result of external forces. And so the paradigm is considerably different in thinking about interventions. Energy medicine, we'll touch on just briefly, and then whole medical systems like Ayurvedic medicine and traditional Chinese medicine. So who uses CAM? Well, a lot of people you know use CAM. Some of them to treat their cancer, some of them to treat their back pain, and some of them just to feel better. The most recent survey of CAM use in the US is the 2007 Centers for Disease Control National Health Interview Survey. And this is a questionnaire survey that's performed every few years by the CDC, randomly telephoning Americans at home. This survey included 23,393 adults over 18. For the first time, this survey also included the parents and guardians of children, about 10,000 of them, age 0 to 17. And they found, very much like what was found almost 20 years ago,